Okay. Hi, my name's Tiffany Ong,
And I'm Simone de Malash.
and our topic is the healthcare system in Japan. So we're going to start off first with a little history about the healthcare system in Japan. In 1868, the rise of the modern healthcare system in Japan started. The Meiji government began to introduce medicinal practices from the West, and in 1872, public healthcare services started to begin. And in 1938, the Ministry of Health and Welfare and the National Health Insurance Law was established. The Ministry of Health and Welfare combined all the different parts of public health and medical services into one structure, and the National Health Insurance Law provided Japanese residents with insurance benefits to compensate for sick, maternity, injury, and injury or death. In 1961, universal health insurance coverage was introduced. This provided all residents of Japan with equal access to medical services. And we'll start off with a overview of the healthcare system in Japan. The Japanese healthcare system has a universal healthcare coverage, that being that it only covered around 70 to 90% of the health expenses for the Japanese residents. There are two types of health insurances in Japan, one being the employees' health insurance system, and the second being the national health insurance. The employees' health insurance is given to the people that are employed with the company, and the national health insurance is given for unemployed individuals and it is controlled by municipal governments. There's also government agencies that are involved with the Japanese healthcare system as well. This being the Ministry of Healthcare, which is in charge of approving health regulations and rules, and the Pharmaceutical and Medical Device Agencies, which is involved in looking over pharmaceuticals and medical devices. Although healthcare coverage is universal, the Japanese government determines what services are covered by insurance. These services include hospital visits, primary and specialty care, dental care, physical therapy, mental health, and hospice care. Maternity care is not covered by the healthcare system, but it is covered by the statutory health insurance system, which gives payments to healthcare facilities for childbirth services. Mental health services are given in outpatient, inpatient, and home care places. And for those with chronic mental health conditions, they are given a discount on their coinsurance rates. The types of procedures that are covered in mental health services in Japan are different: psychological tests, therapy sessions, and rehabilitation procedures. There are some benefits to the Japanese healthcare system as well, being that the standard of health in Japan is very high. Japan has one of the highest life expectancies in any country in the world. Japanese clinics and hospitals have access to very new technological devices, allowing for a higher standard of care. The healthcare system in Japan is run on a nonprofit business model, so every hospital and clinic is owned fully by doctors instead of corporations. With the healthcare system design in Japan, there is a lot of early childhood care and an emphasis on family care. This is beneficial because the emphasis on healthcare in early childhood contributes to a decrease in social costs and less problems with certain chronic diseases. Although there are benefits to the Japanese healthcare system, there are some issues with it. One recent issue that has been happening is there are less healthcare workers in the field due to mental health issues. Due to COVID, many healthcare workers are resigning due to mental health problems such as PTSD, depression, anxiety disorders, and sleep disorders. And since the population is aging, there is a need for more healthcare workers to be able to take care of them. Another issue is that medical expenditure has grown rapidly as a result of increased access to medical care. Provisions of benefits for high cost medical care and free medical care for the elderly since 1973. Since the population is aging, it creates a greater pressure on the finances of the national health insurance system. This then results in most of the taxpayer dollars going towards some medical care for the elderly.
Some strategies to ensure quality of care. One strategy used in the healthcare system of Japan to ensure quality of care is implementing healthcare delivery plans for different regions in Japan, such as detailed plans for ailments such as cancer, stroke, and diabetes. Prefectures, which are in different districts in Japan, are responsible for regulating hospital inspections about once every year. And with this, these prefectures have a medical safety support center for complaints about the healthcare services administered and are designed with ensuring safety in hospitals and clinics. And lastly, the Japan Council Quality of Care is an organization that helps to improve quality of healthcare and maintain clinical ethics and procedure in Japan. Physician education in the workforce. The Japanese government controls the amount of people that are admitted to medical school and the amount of residency programs that are present. Around 2/3 of medical students in Japan attend public medical schools, and the other 1/3 of students attend private institutions. The Japanese government has been taking measures to promote healthcare in rural areas, such as implementing subsidies for municipal governments to form and maintain adequate healthcare, and having student loan forgiveness options for healthcare professionals. Primary care practices in Japan are made up of doctors and some nurses. And with this, in some areas, nurses can work to organize care for complex patients, and their job requirements differ depending on the hospital or clinic that they work at. Outpatient care. A majority of outpatient care in Japan is administered in hospitals, and some is offered in clinics. And at these clinics, patients are able to go into without being referred to by a doctor. At hospitals, outpatient specialists are usually given a salary and additional payments for services such as working shifts in the late evenings. Healthcare professionals that work in public hospitals have the ability to work at other healthcare facilities by getting approval from their employers, which in this case would be the physicians that are in control of the hospitals and clinics. Outpatient care facilities have a service called after hours, in which there are on-call physicians present and available for late night shifts. These outpatient facilities have walk-in hours for patients and after-hours care at a majority of the healthcare facilities in Japan. And for these after-hours care, hospitals and clinics in Japan get paid additional fees. Control of healthcare costs. Control of healthcare costs in Japan are broken up into three types of methods: overall rate of change in pricing of benefits, the revised prices for pharmaceutical drugs and medical devices, and the pricing of individual services. The revision of prices for pharmaceutical drugs and medical devices are based on a survey of current prices. And the prices for medical devices in Western countries such as the United States are factored in and looked at while revising these drug prices in Japan. Another way for controlling healthcare costs in Japan is the implementation of a national cost containment plan, and which is a plan that helps promote healthy lifestyle choices, utilizing home care development to help decrease the amount of time a patient stays in the hospital, and it helps to promote the adequate use of pharmaceutical drugs. The future of the healthcare system in Japan. Japan's healthcare system is gradually changing and is expected to continue on that trend in the next couple of decades. Some current trends in Japan's society that will affect the delivery of healthcare in the future are the changes in demographics, the increased amount of urbanization, and the vast amount of technological change. In Japan, there are two ways in which the demographic of the country is changing. The first way is by the aging of the population, and the second way being the very low birth rate in the country. There will be a lot of changes in medical needs of the population over time, and a lot of change in the amount of spending for healthcare services as a result. The increased urbanization that is happening in the country is causing a change in how healthcare is delivered, as those in secluded and remote locations in Japan will need to be accommodated for, as they don't have a multitude of hospitals and clinics in the rural areas as they do in the large cities of Japan. And the implementation of applications in social media is shifting how healthcare is administered here, seen as how individuals could be able to store health information and health records on their personal devices and have them available to show at hospitals or clinics visits and help make their visits more meaningful and effective. And that's our presentation. Thank you all so much.